Are you struggling with frequent change of glasses, and even after changing the glasses, if the vision is not clear, then it could be a sign of keratoconus. I am Dr. Bhanu Prakash. I am a senior consultant, Cataract, Cornea Refractive Surgeon at Yashoda Hospital, High-Tech City branch. Keratoconus is a condition wherein the cornea becomes thin and conical. It happens in patients who are like young and young adult or teenage who have little bit of allergy, wherein the complaints will be itching of the eyes, watering. These are the patients where they have a glass prescription which has includes cylinder of more than 2. So if you have glasses, if the cylinder is more than 2 and you are changing the glasses frequently, then it could be a sign of keratoconus. And if neglected, it can progress and worsen and it can decrease your vision. So the good news is that if it is detected early, then we have a treatment which can stop the progression of the keratoconus. That's called collagen cross-linking. Collagen cross-linking will stop your keratoconus progression, and also it can improve your vision and decreases the chances of corneal transplantation in the future. So get your eyes checked with a local eye doctor or ophthalmologist, preferably a corneal surgeon. If you are having a frequent change of glasses of cylinder of more than 2 and the present glasses are not giving good vision even after changing the glass prescription, your eyes are your future, so protect it and get your eyes checked regularly if you have been diagnosed with keratoconus.
Like, comment, and subscribe for more health updates.